So good evening all of you. I am Dr. Sunil Washimkar. I am a consultant cardiologist working in Super Speciality Hospital, Government Medical College, Nagpur. Nowadays often it has been seen that more and more younger generation is suffering from heart attacks. If we talk about today's lifestyle, more and more people are suffering from this disease because of multiple factors like say hypertension, diabetes, obesity, stress, smoking, tobacco, excessive alcohol consumption. A healthy heart is the one in which a particular person according to his age does a specific group of activities without getting any fatigue or without getting any chest pain. If we talk about heart attack, a heart is a muscular pump in our body which pumps blood to the whole body, and the circulation is maintained because of the pumping of the heart. So basically this muscular organ also requires blood supply, which is usually given by 3 vessels. Now whenever there is blockage in these vessels, there is no blood supply to the heart, and people suffer from heart attack. And the causes for development, as I have already told you, like hypertension, diabetes, these or dyslipidemia, they cause blockages by damaging the inner lining of the vessels, and because of reduced blood supply to the heart, that part of heart is it usually gets damaged, and therefore you have a heart attack. And when you have a heart attack, either you can have a heart failure or your heart rate can go berserk, which means that the heart rate can reach up to level of 150, 200 or more so, and the patient can succumb because of that. If you encounter any patient with a chest pain on the street or otherwise also when a person is working in office or elsewhere, then the patient needs to be immediately taken to a healthcare professional or the nearby hospital. Most of the times I encounter relatives telling that the patient or a person had slept at night and he didn't get up in the morning. So are there any other disorders which are responsible for sudden cardiac death apart from heart attack? And the answer to this is definitely yes. There are other disorders like hypertrophic cardiomyopathy or anomalous coronary arteries and so on and so forth, which can cause sudden cardiac death. These are hereditary disorders which runs in families. Say for example, if your father is suffering from that ailment like hypertrophic cardiomyopathy, the child has a significant chance of having the same disorder and he can suffer from sudden cardiac death. As we all know, with increasing competition, increasing stresses of life, we are all suffering from lifestyle disorders. Stress being a non-modifiable risk factors, and of course obesity, junk food, all these things are responsible to a greater extent for increasing incidence of heart attacks. The development of blockages in the heart, it usually starts in adolescence, and thereafter the progression of these blockages, it depends upon how you have your lifestyle. So if you have a bad lifestyle, for example, if you are smoking, if you are obese, if you have too much of cholesterol in your body, or if you have too much of stress, then you develop a heart attack at an earlier age. That is what is happening in India and Southeast Asia, where we are suffering from more and more heart attacks at a younger age group. A healthy person, whether a healthy person can have a heart attack, a healthy person usually has lesser chances as compared to an unhealthy person. Unhealthy person means that a person is having a sedentary lifestyle in the form that he gets up late, he doesn't exercise, he smokes, he eats, his dietary habits are absolutely berserk. And if a person wants to live a longer life, a healthy life, he definitely has to keep his heart healthy. And to keep his heart healthy, he has to do regular exercises like what we recommend. Our protocol is around 45 minutes per day, at least 5 days a week, a brisk walking, or you can do other forms of exercises like cycling, swimming and so on and so forth, depending upon whether you have been investigated. Now, whether all patients of heart attack they need angiography, that is what is the question which is required. So the answer to this is, by certain set of people they say that you should be subjected to angiography so that you can see whether you have blockages in your heart or not. And if you have blockages in the heart, which is definitely shown by angiography, angiography is a test which tells you whether the blockages in the heart are significant or not. So when I do an angiography, or when we do an angiography of a particular person who has suffered a heart attack or who has a angina, chest pain I mean to say, so you have blockages. If the patient has a blockages less than 70%, we assess on the basis of a computer analysis or a eyeballing method, then these patients are usually given aggressive lifestyle modification. Needless to say, all medicines are to be taken properly. If the patient is having blockages more than 70%, then the patient is subjected to angioplasty or a bypass surgery, depending on how many blockages and the type of blockages. So if the patient is having calcific blockages, main vessels are blocked, then the patient is subjected to a bypass surgery. Now what we do in angioplasty is basically whatever blockage is there, we clear it by balloon. Initially we dissect it by balloon, and thereafter, to maintain the patency and scaffold of the vessel, we put a stent. Now there is a common misconception that once you are done with angioplasty, everything is good, but it's not like that. You can have blockages after angioplasty at the same site where the stent have been put, or at the other sites also, and therefore even after angioplasty, or for that matter even after bypass surgery, you need to have a good lifestyle modification in the same setting. Now lifestyle modification again means that you have to lead a stressful life, a stressless life. You have to do daily exercises, your dietary habits needs to be good, you have to be on proper medication, and of course you have to be on regular medical checkup with all the patients. Now if my father had a heart attack, so what are the chances I am going to have a heart attack? So these are also, there is genetical linkage for heart attacks. So if somebody's father has a heart attack, and he definitely has a more chance. Similarly, if my father had a diabetes or a hypertension, then I am going to have a higher chances of both these disorders, and both these disorders definitely can lead to blockages in the heart. For years together, we have been taught to lead a healthy life, a longer life and a healthy life. What is more important in today's scenario, because more and more people are being subjected to stressful life conditions, they follow more sedentary lifestyles, and therefore they suffer from various heart attacks. So my message to all the viewers is, if you want to lead a good healthy life, you have to have your lifestyle modification strictly. Be disciplined. I am not saying that a younger person should be too strict in his diet, but you should exercise everything in moderation. Say for example, right from dietary moderation to exercise moderation will definitely help you. And India being a developing country, and we are having a huge amount of youngsters who contribute to a greater extent to our country's development, and if they fall prey to heart attacks, and definitely thereafter a person becomes handicapped, it's a national loss. And similarly, we don't want that more and more people will be should be dependent on country, rather than we should make our country go ahead with whatever resources we have. So to lead a good healthy lifestyle and a good healthy heart is going to help us in building our nation. So thank you very much.